What is your cervix doing in there? Have you wondered that? Today we're going to talk about some signs that you are dilating. There are some things that you can watch out for, so let's get going. But in case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm also the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth. Today we're talking about dilation. I want you guys to first off understand what that is. Some people somehow think that that's part of your pelvis, like your pelvis is dilating, and that's not the case. It's your cervix. So your cervix is the end of the uterus, and that is what is dilating as the baby's head is pushing onto it. It's the end of your cervix. It doesn't have anything to do with your vagina, anything to do with the birth canal, other than the cervix ends in your vagina, and that's where it is. Now, when we go in to check you, we kind of come this way, and we check, and it's kind of up top of your birth canal. But what are some signs that you are dilating? The first one is needing to pee more often, or maybe even breathing a little bit better. That usually shows that baby has dropped. Now, of course, we don't drop babies, but it just means that baby has descended into your pelvis. Some people will actually feel like the baby, like all of a sudden, drop into their pelvis. But most people, it's kind of like a slow descent. And all of a sudden, maybe they wake up one day and they just think it's a little bit easier to breathe. But then they notice they need to pee more. Because if baby's up here, that means they're in their lungs. But if baby's down here, that means they're in their bladder. There really is no winning with these babies and pelvises. So needing to pee more often, breathing a little bit more just shows that baby has dropped, and that can be a sign that you are dilating. Now, there are babies that are super low in the birth canal where you haven't dilated, so that's not a sure sign either. Cervixes are tricky. Quick note, if you are needing to pee frequently, you feel like you don't totally empty your bladder, it burns, things like that, that could be a bladder infection. So if you're feeling like you need to pee more frequently and there isn't a whole lot there, it's always worth mentioning to your provider. They can really quickly test your urine in the doctor's office and see if that's your problem. Okay, as baby descends into here, I think you sometimes feel like kind of a stabbing pain in the cervix as the baby's head is pushing on it and it's starting to open up. Now, some of you are wondering, how does dilation work? It's just the same as if you or I were to put on like a tight sweater, right? A sweater with a very tight neck. So it goes on, right? And it stretches out. I'm ruining my hair while I'm doing this. And that's how it's the same thing. It just starts to open up, slow motion, and then finally stretches over the baby's head. And that is dilation. But as the baby is pushing on it, you can imagine that there could be a little bit of pain. Of course, we've always been told that there were no nerve endings in the cervix. But if you've had an IUD placed or have a pap smear, a lot of times it sure does feel like your cervix has some nerve endings. So I don't know what way they were thinking all along. Some people may just have more pressure in the birth canal area. So that's something that can be a sign of dilation as well. Another one can be the loss of the mucus plug. So down here, there's a collection of cells, and that's right, mucus, that is sort of corking off the baby. We think that it's there as a protective mechanism so that baby is safe up in the birth canal. Of course, they're surrounded by the amniotic sac, but the less things that can get into the uterus and possibly cause infection, the better. So your body creates what's called a mucus plug. But as your cervix opens up, the mucus plug kind of has nothing to hold on to. I like to think of it if you had like a bottle of wine upside down and the top started to melt and expand a little bit, of course the cork would fall out. Same with a mucus plug. So if your mucus plug has fallen out, that can be a sign that you are dilating. Fun fact, you can also be dilating without your mucus plug falling out. I actually only saw it on my third baby, third out of 3, and it made me gag. So I'm not a big fan of the mucus plug, but it's just something that if you see, usually you see it when you wipe or just in the toilet after you pee. As you get closer to delivery, it can be a sign that your cervix is starting to dilate. By the way, you do not need to save it. You do not need to take a picture of it on your phone and tell us. We believe you. And while it is a great sign that you might be dilating, it really doesn't mean anything for us in labor and delivery. Now, some of you may have heard about the purple line. It is a line that goes up between your butt cheeks and may show that you are dilating. The problem is, if you are a person of color, it is very difficult to see that line. It also just doesn't show up on some people, so it can't really be a reliable indicator, but it could be something to notice as you're starting to dilate. I tried to look for the purple line, although it's not that fun to look for as it is between the butt cheeks, so take that for what it's worth. So why do we care about the signs of dilation? Well, we may not actually care all that much. We're really looking for the signs of active labor. That's the thing that's going to trigger you to go into the hospital. But I know a lot of you really want to know when this baby's going to come out. And so these signs of dilation can show that things are starting to happen and you might have your baby in the next couple of weeks. you could also wait. However, on my last baby, I was dilated to a 4 for weeks. Just because you're dilated doesn't mean you're in labor or that baby is going to come out soon. It is tricky, and those uteruses don't make things easy. Don't you agree? So just because you see some of these signs doesn't mean you should head to the hospital. But if you're having severe consistent pain, you definitely want to talk with your provider. And if you have any questions about any of these signs, take them to your provider. They're a great question to start some conversation at your appointment about what's going to come up. Okay, I hope you found these signs of dilation helpful. Please give this video a big thumbs up if you liked it, and give me a follow so that we can hang out for the rest of your pregnancy. I have tons of videos on topics just like this, so make sure that you check out my other videos. I think you'll find them super helpful.